and thank you very much for giving me the opportunity to be here. And of course, thank you very much for always being an absolute support to work towards identifying, tackling, and kind of trying to work towards awareness and increasing the involvement of all the stakeholders, including teachers, schools, government, and of course, all ophthalmologists and everybody associated with child eye care. So it's because of this team that's there that we can see who are on the screen now, and a lot of people behind, because of which we have taken some small steps in tackling this massive global epidemic that we are facing. So I'll just kind of briefly shed light on the major issues and what ways we can move towards tackling this major problem. Essentially, a lot of us were not particularly concerned about myopia per se. It did not really register with us significantly until this paper in 2016 by the Brian Holden group came, which predicted rather shockingly that 50% of the world's population will become myopic by 2050, and 10% of these will actually be high myopes with a very high risk of developing non-recoverable or non-reversible visual loss in the form of retinal detachment, glaucoma, and of course, increased risk of developing cataract. So this was the Shake Up Everybody paper that really made everybody sit up and start thinking about actively working, particularly in our country, which always thought that myopia is not a particular problem. Even our study, and great many thanks to Dr. Praveen Vishisht and his team, that we could take out this survey evaluation in which we found the prevalence of myopia about 13.1% and the cumulative incidence in the study of about 3.3%. Now, this doesn't look so bad when you compare it to the East Asian prevalence and incidence studies. But the important thing was that this was done in an area where just a little over a decade before a kind of similar prevalence study was done. And in that, although there was a fair amount of difference in the methodology, but still there was just a decade, an increase in the prevalence of myopia from 7.1% to 13.1%, virtually doubling if you look at it in a way. And of course, a lot of studies that have shown that Indians per se are not immune to developing myopia. So the world is immune, and all races have seen an increase in myopia of the last few decades, although this rate of increase is varied between the various races. This one paper from Singapore was very interesting, showed that the first generation Indian immigrants to Singapore had about 12 to 14% myopia, which is kind of similar to what we see in India among the urban middle class and affluent people. But the second generation of this very immigrant population had almost 28%. So the Indians very quickly developed the same problem and were affected by the same environmental factors that the East Asian races were affected from. So Indians per se are definitely not immune to this problem. One of the downsides which we all felt was with the Brian Holden paper was that they kind of sidestepped Indian data because they did not find any good, robust studies which they could use to project the prevalence in India and its projection by 2050. So we collected this data of all identifiable published literature in the last 4 decades from 1980 to 2020. And we, over this, were able to almost cover 3 lakh children between urban and rural children of all the data that was published. And this also gave out some very, very startling observations. We had a crude prevalence of 7.5% over the 4 decades. The other important thing was that in rural, you could see that it was not so less. The other important thing was that there was a significant increment in the prevalence noted in rural children to 6.8%, showing that there is a major change in the rural environment, particularly due to the massive penetration of digital devices and internet services. Of course, a reflection of the advancing Indian technology landscape, but unfortunately not so great for the prevalence and progression of myopia. So definitely myopia is an important factor in India. The major risk factors, of course, one of them is genetic. We know that some genetic predisposition is there. Ethnicity has shown that there are racial differences as far as the susceptibility to myopia is concerned, although every race is susceptible. But the most important are the environmental risk factors, which is early age close work, intense long hours, low exposure outdoors, low ambient illumination while studying, reading, lack of outdoor activity, and urbanization. So these are important environmental changes that have increased the prevalence of myopia world over. And we know that the world per se is becoming increasingly urbanized. So we know that progressively the myopia is going to increase. And maybe if the current trend continues, especially with the COVID having impacted a huge change towards indoor activity, work from home, there is a possibility that we'll achieve that 50% much before 2050. So what are the ways in which we could actually work towards preventing this from happening is primary, secondary, and tertiary prevention. So the primary prevention would be to talk about and to spread the information regarding interventions that can prevent the development of myopia in a child, to prevent a child from becoming myopic. Secondary would be to identify these myopic children and prevent myopic progression. And finally, the tertiary prevention would be to prevent complications and prevent blindness due to myopia. So the most important impact that can be made in primary prevention is more time outdoors. This is a slogan from Singapore, make myopia go away, go outdoors and play. That's a huge important role of outdoors activity. So increase outdoor activity, decrease near work. Unfortunately, again, it's not possible to absolutely stop or markedly reduce it, but there are major changes that can be possible in the lifestyle of a child, like taking frequent breaks after every half an hour, take a 5-minute break, only read on the table chair, have the object that you're reading at least 1 arm length away, and that is only possible if you read on a table chair, have good ambient room illumination, go outdoors for at least a couple of hours, have your screen or table opposite a bright window so that the moment you look up, you're looking out into the far distance. Of course, there is a lot of talk about low concentration atropine used as preventing development of myopia in pre-myopic children who are highly susceptible to develop myopia over the next few years as they grow older. This is something that is being tried in East Asia, where they have this major percentage of children with myopia, but as yet, I would say its time has not come in India. But you can see the major changes that have been conceptualized in East Asia, including compulsory outdoor activity, 20-minute outdoor recess times twice a day, sending out for their daily breaks, ensuring that they're in the sunlight. This is a graph that is showing that, as you can see, increasing time outdoors is reducing markedly the risk of incident myopia. So these are clear evidences that outdoor activity does have a protective effect on incidence and progression of myopia. The other outdoor programs that can be implemented and have been done successfully in a lot of countries, including classes, assemblies, and recess being ensured that it is done outdoors. So the child is spending some time outdoors in the sun or in bright light, outdoor sports classes, and of course, ensuring that there are playgrounds available for children of all ages, and they are not barricaded and they are not kind of out of bounds for children from playing. So these are important things. The other implementations that have been seen are modifying the classroom design to allow more light to come, have an extended field of view, increasing the break times, and again building awareness. So these are major public health initiatives and interventions that have been successfully seen to have been implemented in a lot of East Asian. The time has come that we as a group should work towards ensuring that awareness among the policy makers is done so that a change can be made. For preventing secondary preventions, the most important, of course, is to augment and to ensure that we strengthen the school screening program, to work towards possibly creating a preschool screening program so that children can be identified with having refractive errors and amblyopia prior to their enrollment in the school and prior to them suffering years of poor vision, because of which their performance may be affected. The other thing is identifying these children, referred and managed and provided quality spectacles and a regular program to check them, so that progressive or increase in refractive errors can be managed by providing changing glasses. And of course, intervention techniques can be provided, interventions can be given to prevent the progression of myopia. So there are a lot of optical and pharmacological interventions that are there that can be utilized to reduce the progression of myopia, including special type of myopia spectacles, contact lenses, and of course, low dose atropine that is found to be fairly effective in preventing progression of myopia. These are some special quality soft contact lenses. These are multifocal contact lenses that again have been approved by FDA to prevent progression of myopia among children. They are fairly effective, including spectacles that are in India more acceptable and are from a cost and from a side effect perspective far better alternatives. And finally, tertiary prevention. We know that there are changes that are possible in progressive and high myopia, and it is very important, firstly, to prevent them from developing high myopia. And all children who have high myopia should be annually screened unless they have some identifiable lesion which may require more aggressive intervention. So one would say that it is a public health issue world over, and it's an important that there should be a global public health response from all the possible stakeholders. Public health initiatives are essential, and there is a necessity change in behavior to reduce avoidable risk factors, and we need both public health as well as practitioner-led initiatives, and education and communication with the patients, parents is very, very important. It is the duty of all the healthcare professionals and those associated with children to prevent this epidemic in the next generation. Thank you, AIOS and Dr. Praveen, for giving me the opportunity to be a part of this wonderful session.
Thank you. Thank you so much, Dr. Rohit. In fact, it was a wonderful presentation.